Good day, viewers. I'm Dr. Hannah Norton, representative of the Homeopathic Association of South Africa. Population statistics indicate that 463 million adults and 1.1 million adolescents worldwide currently living with diabetes today. In honor of World Diabetes Awareness Day, we have Dr. Ayal Peretz with us here today to take us through some important aspects of the condition. Dr. Peretz, good day to you. I trust you are very well indeed.
I am very well, thank you, and I hope you are also.
I am indeed, thank you. And thank you so much for being with us here today.
Thank you for having me.
It's an absolute pleasure. Dr. Peretz, would you be able to take us through the difference between type 1 and type 2 diabetes?
Sure. So type 1 diabetes is actually an autoimmune disease where your body attacks the cells within the pancreas that produce insulin. So what happens is your body can no longer produce enough insulin for the amount of glucose that you consume. So the glucose and the sugar is unable to now enter the cells, particularly the liver and the muscle cells, because of the lack of insulin. With type 2 diabetes, the muscle cells and the liver cells actually become insulin resistant. So they're not as sensitive to insulin anymore. So you need more insulin for the same amount of glucose to enter the cell. So, yes.
And what sort of symptoms might a patient with the specifically type 2 diabetes present?
Some of the symptoms that they would start to present with is weight loss or sometimes weight gain as well, usually weight loss, hunger, fatigue, very thirsty, and increased urination.
Because we in the profession, we're aware that the majority of individuals will be suffering with a condition of type 2 diabetes, whereas a lot of the statistical information is about individuals that suffer with type 1. Because it's the more predominant condition in South Africa, could you take us through how a homeopathic doctor would go about diagnosing the condition of type 2 diabetes?
If a homeopathic doctor suspects that a patient may be suffering from type 2 diabetes, in the room, we may do a glucose test with the glucometer, which is just a prick on the finger. And we can also do a urine dipstick test to measure the glucose in the urine. When you have diabetes, you urinate more glucose because there's more glucose in the blood. Then if we want to take the test further, we can send the patient to the lab and we can get them to do a fasting glucose and a fasting insulin test. And then if we want to, we can also send them for a glucose tolerance test.
And from a homeopathic viewpoint, what nutritional and lifestyle factors can an individual living with the condition address to assist their state of health?
That's a good question. When you look at diabetes, the biggest risk factor for diabetes is actually obesity. And the reason for this is that insulin resistance is actually caused by fat infiltration into muscle cells. We also call it intramyocellular lipids. So what we want to do is we want to decrease the fat in our diets and increase the whole healthy foods. And the reason why fat is bad is when fat gets into the cells, it kind of gums up the mechanism that insulin uses to allow glucose into the cell. And then that makes the cell insulin resistant. So the less fat we take in, the better, particularly saturated fat. To add on to the issues with saturated fat particularly is saturated fat and cholesterol have actually been found to destroy the cells in the pancreas that produce insulin. So not only is it causing insulin resistance, but it's also causing us to produce less insulin to be able to open up that lock in the cell to let glucose in. Some other things that we can do to decrease fat and increase insulin sensitivity is actually exercise. So exercise has been shown to not only decrease the fat, but increase the sensitivity of the cell to insulin. So what is recommended is actually to go onto a whole foods diet. So get rid of all the processed food, the high sugary food, the high fat food, particularly the foods high in saturated fat and cholesterol, exercise program, and to decrease stress as well, because stress definitely does play a role in insulin resistance and diabetes.
Perfect. And from that homeopathic viewpoint, we understand that treatment is individualized, but are there any predominant remedies which show an application in the treatment of diabetes?
And so, like you said, homeopathy is extremely individualized. So, two people with diabetes will most likely get two different remedies depending on their symptoms, because everyone's symptoms to diabetes is very different. Some people may be suffering from thirst more than hunger, other people hunger and fatigue more than anything else. So to go into specific remedies is difficult, but what homeopaths often do is use homeopathic tinctures in conjunction with the homeopathic remedies. Two of these being Syzygium and Gymnema, which have been shown to increase insulin sensitivity, decrease blood glucose levels, and actually decrease cholesterol as well.
Perfect. Thank you so much, Dr. Peretz, for your valuable input and your time here today. And to those viewers out there who may be considering a homeopathic approach to the management of their condition, I'm going to encourage you to navigate to the practitioner search engine at the Homeopathic Association of South Africa's website, homeopathy.org.za, to locate a practitioner near you. We at the HSA wish you very well on your health journey with homeopathy, the wellness profession.